Good morning.
Good morning.
Thanks for coming in. We're going to make a video recording of a method of thyroid examination. Is that okay with you?
Yes.
We've put you in glasses and disguised you slightly, but this will be shown to medical students and could be seen by a wider public. And are you okay with that?
Yeah.
Great. Well, thanks very much for
You're
helping.
welcome.
Because it's a physical examination, of course, we'll be feeling your thyroid. Just do let me know if at any time that's at all uncomfortable, and we would certainly stop. Okay, great. So I'm just going to be talking a little bit about thyroid before we start to examine. And when we have a patient come in for a thyroid interview, we usually take time to just have a general inspection and a check of your heart rate to see whether it seems like your thyroid hormone levels are normal. In other words, that you are euthyroid and you look quite comfortable. I don't see any tremor. Can you stretch your hands out in front of you? No, excellent. Usually we would examine your eyes as well for signs of thyroid affecting your eyes, but I think we'll leave that for today and go straight to looking at your thyroid. Okay, so when we examine your thyroid, the first thing we would do is have a look straight on at the front of your neck and just see if there's any obvious prominence over this area here, low in the neck, where the thyroid is usually situated. Um, Also, we do look from the side to see if there is any bulging from the side or lateral prominence that might suggest thyroid enlargement as one of the more sensitive indicators, and I don't see that in your case. But we know that the whole thyroid examination gets a lot better if we get you to do some swallowing. The thyroid is attached to some tissues here and moves up and down with swallowing because it's attached to the trachea. So actually, Susan, I think I did see some enlargement there. So we'll just look a little bit more closely. Take a sip. Just bring your hand down and let your shoulders just slightly extend. And here we see that this area does move when you swallow, and it even seems as if there may be some bulkiness here when you do swallow. Okay, so on inspection, I'm thinking that there may be some enlargement because although it's not unusual in slim women to see the isthmus here between the two lobes of thyroid, it is a bit unusual to see the A lobe as we can see your right lobe. So that's inspection. We come on to palpation, and the first thing in palpation is just to make sure that we're looking at the right thing. So I'm just going to check your neck in a few ways. Way up high, we've got hyoid, which we won't really feel for. The first prominence, and much more prominent in men than women, is this little point at the tip of the thyroid cartilage. Coming down from there over the thyroid cartilage, the neck structure is actually a little bit of a dip here between the bottom of the thyroid cartilage and the cricoid bone, which is a little circle of bone around the trachea here. And we know then that the isthmus of the thyroid for most individuals is just below that. And we saw it in your case. So I'm just going to hold my thumb there and get you to take a little sip, swallow. And there I can feel as you swallow that the bridge between the two lobes, the isthmus, comes up under my thumb. And in your case, it feels normal. It's maybe a few millimeters thick, and it's not particularly firm. I don't feel a nodule there. But here I'm beginning to feel, remembering trachea is wrapped right around the trachea, thyroid is wrapped right around the trachea, that there is some fullness here. So in this right lobe, let's get you to have another sip, swallow. And there you can see that I've almost trapped that right lobe with the swallow. Was that sore at all? Did that bother you? Okay. Because we may do it again.
Okay.
Because definitely there's about a 2.5 centimeter enlargement of this lobe, which is much more apparent when you swallow. So again, just placing my thumb wrapped around the trachea, slightly pushing aside this sternocleidomastoid to get in the right position, and get you to sip, swallow, and there's that nodule. Okay, coming then to your left lobe of thyroid, also of course attached to the isthmus. Just let your head down a little bit so I can slip in again right around the trachea and swallowing. Okay, so this lobe is also palpable. Probably that means it's a little thicker and firmer than normal, but no more than about 1.5 times normal size, I would say. And those are our jobs examining the thyroid, is to determine the size and shape of each lobe, any irregularity, the texture of the thyroid, and the presence or absence of any nodule. So in your case, I think there may be some generalized enlargement of your thyroid, but to no more than 1.5 times normal size. There is a definite thickening in that right lobe, up to about 2.5 centimeters, I would estimate. Maybe a nodule in that location. With or without a nodule, we would always finish up the thyroid examination by just making sure that there's no lymph nodes in the neck. The lymph node examination is quite, in my hands anyway, dissimilar to the thyroid, where I try to keep my hands still while you swallow. In this case, it's almost like a massage to see if there's any fixed nodules in your neck that could be pathological lymph nodes. And there are none. Great. So we'll stop there for a minute. There are a couple of other maneuvers that we can do, but I'll give you a break for a minute.